All right, this is my presentation on the systematic disorder of leukemia, and my name is Bryant Larkin. First off, a description of leukemia. Leukemia begins in a cell in the bone marrow. The cell undergoes a change and becomes a type of leukemia cell. Once the marrow cell undergoes a leukemic change, the leukemia cells may grow and survive better than the normal cells. Over time, the leukemia cells crowd out or suppress the development of normal cells. The rate at which leukemia progresses and how the cells replace the normal blood and marrow cells are different with each type of leukemia. Next is the diagnostic tests or tools they may run to see if you have leukemia or suffer from leukemia. The first one is a blood cell examination. Other blood samples may be taken and checked for type and shape of blood cells and examined for other substances released by your body's organs and tissues that may be signs of disease. The second one is the complete blood count, or CBC. This blood test gives details about the red blood cells, white blood cells, and platelets. If you have leukemia, you will have lower than normal counts of red blood cells and platelets, and higher than normal counts of white blood cells, or WBCs. Imaging and other testing, that's basically just your doctor or the chest x-ray, CT scan, magnetic resonance imaging, MRI basically. And if you have symptoms that indicate a complication of the leukemia. All right. Okay, hold on 1 second. Wow, there we go. All right. The cause and the treatment of leukemia. The exact cause of leukemia is not known, but it is thought that it involves a combination of genetic and environmental factors. Leukemia cells have acquired mutations in their DNA that cause them to grow abnormally and lose functions of typical white blood cells. It is not clear what causes these mutations to occur. Treatment is highly variable. For slow-growing leukemias, treatment may include monitoring. For aggressive leukemias, treatment includes chemotherapy that's sometimes followed by radiation and stem cell transplant. All right. The signs and symptoms and prognosis of leukemia. The signs and symptoms is a lot more than these, but try to keep it like low for so it can fit all on one side. Try to make like get the big ones. Leukemia symptoms vary depending on the type of leukemia. Common leukemia signs and symptoms include fever or chills, persistent fatigue, weakness, frequent or severe infections, losing weight without trying. All right. Long-term survival of leukemia varies greatly, depending upon multiple factors, including type of leukemia, age of the patient. In general, the disease goes into remission in nearly all children who have it. More than 4 out of 5 children, at least 5 years. And the prognosis for adults is not as great as the one it is for children. Oh, and that was my last slide. Okay, that's my presentation on the systematic disorder of leukemia. All right.